In 1998, the measles virus was officially eradicated from North America. Fast forward to today, and incidences of the disease are back on the rise. The most likely reason, according to the World Health Organization, a dramatic decline in vaccination rates. According to UNICEF, 287,000 Canadian children were not vaccinated against the measles virus between 2010 and 2017. I went to visit the University of Alberta's School of Public Health to find out more about this issue. I want to know, how did we get to this point?
You need to sign it. Perfect. When we use these 4 virus combinations like we're using now, most people will pick their non-dominant arm just in case it's sore.
So the flu shot, like the one I got, is different every year as different virus strains develop. So yes, the effectiveness of an influenza vaccine will vary from year to year. However, other vaccinations like measles, mumps, rubella, or polio are always highly effective. And effectiveness isn't what many anti-vaxxers are talking about, though. They're worried about side effects that have no scientific basis of actually occurring.
The World Health Organization earlier this year declared the spread of misinformation in this context one of the single biggest threats to public health in the world. Well, first of all, I think it's just the platforms. You got social media, you have other kinds of avenues that people can spread this misinformation. You have the creation of communities online that allow this information to percolate. So I think that's a big part of it. The other thing is a broader social phenomenon, and this is the breakdown in trust that we have for our institutions, right? Breakdown in trust that we have for the healthcare system, for our government. And this, I think, has allowed these alternate voices to creep in, to have more sway. So even though the anti-vax community is a relatively small group, they have the ability to influence the individuals we call the vaccination hesitant. And I think that's what's going on, and that's one of the reasons it's become such an international problem.
I found this out by heading to Facebook to see if I could join some anti-vax groups. The first thing that you'll notice on these groups is a misinformation warning placed by Facebook directing you to a WHO page on vaccinations. And there's a second warning that pops up when you actually try to join the group. And as you can see, even then, I can't get access into it. What I did gather from a few posts here and there are that anti-vax advocates either believe that vaccines themselves are inherently harmful or that mandatory vaccination is an overreach of government influence. In Alberta's last provincial election, the Alberta Party promised a program that would mandate vaccines for all children. But would a program like this actually work?
The mandatory vaccine question is actually way more complex than it's often portrayed. I think some people think mandatory vaccines were going to solve the problem. It's not always the case, right? Because there's almost always some form of an exemption. But in addition to that, is it going to result in a polarization of the discourse, right? Are you going to anger those who are against vaccines even more, sort of harden their position? And also, are you punishing the kids, right? So it's the parents who've made this decision, and then you have this kid that wants to go to school and his parents aren't vaccinating him. Are you punishing them? And also you see these institutions and experts getting on social media, right? Trying to play the game the way the anti-vaxxers are. Let's engage the public. Let's talk about this in a way that is going to hopefully win over some of the vaccination hesitant.
Show you how it goes. Now walk it by yourself.
So if you're like 13, 14, 15 years old and you have the ability to understand the risks and benefits of the procedure, your consent is necessary and sufficient. So, that's one remedy I think that we need to start thinking about, is just having kids consent on their own to getting vaccinated.
It is important to realize that the benefits of vaccinations do outweigh the risk. For example, 4% of flu-vaccinated individuals will probably still get the flu, but a lighter version. Without the vaccination, that number goes up to 82%.
I think this is a point that people miss or forget about, but vaccination is not at all just about an intervention for an individual. Goal of vaccination would be to have a high enough proportion of the population immune to whichever disease it is, let's talk about measles, that it prevents transmission of that virus in the community. Implication of that is that it really is a social responsibility for us to be vaccinated, and incidentally protecting individuals who are unable to receive the vaccine or to respond to the vaccine because of cancer, immunologic disease, or treatment that weakens their immune system. And the only way to protect those people is by stopping transmission in our society as a whole. And for measles, because measles is so vigorously infectious, that level of coverage needs to be up around 95%.
There's a tough line health policymakers and lawmakers have to navigate when supporting a parent's right to choose and their freedom of conscience, as well as the public interest of herd immunity.
That's the concern, that the government should not be imposing their will on my kids. I want to make this decision. And there's a little bit of research that kind of argument plays well with these parents. It is very libertarian in tone. There are absolutely certain demographics that are interested in this. For example, we've seen research that shows that people who are interested in complementary alternative medicine are more likely to be anti-vax. Absolutely, it's not, people maybe think it's the uneducated. That's not the case at all. It's often wealthy individuals that have at least a university degree. One of the reasons these arguments are so powerful is their narratives, right? They're a story. And if you're a parent trying to make a decision about your kid, the Jenny McCarthy story may resonate with you. And there's some really interesting research that shows that a powerful narrative, a powerful testimonial can overwhelm the science, right? Can overwhelm your rational analysis of the situation. And I think that goes on a lot here. It plays on fear, plays on parental guilt, and the result is a real disaster.
Now, one really important point that Dr. Houston mentioned to me after our interview is that the perception of the pharmaceutical industry's influence on medical professionals does matter to patients. He says that there is a distrust of the physician connection with pharmaceutical representatives, and that can cause people to become skeptical of the healthcare system's recommendations. Do the business practices change the usefulness of the actual vaccine, though? Of course not. But he recommended that doctors and nurses be more aware of that perception if they want to help increase public trust in the healthcare system.
So polio was a disease that terrified parents in Canada back in the 1950s. And the main tool for polio eradication, control and eradication is the vaccine. And we were so close, it's down to 2 countries, Afghanistan and Pakistan. 3 years ago, we were down to, I think it was about 20 or 30 cases in the whole world. Now it's shooting up again. We know that if these diseases aren't controlled, they will come back. That's kind of common sense. And it's happened again and again. In any disease that's present anywhere can come to Canada within 24 hours. One of the issues about vaccines is that they are victims of their own success. People in countries where they're seeing kids dying of measles are less likely to be vaccine hesitant. Back in the 50s, there was rapid embrace of polio vaccine from people who had seen kids become paralyzed. We have to maintain the level of immunity or those diseases will come back.
The legality of mandatory vaccinations is a difficult one to argue. You don't want to punish a child by restricting them from public services because of the actions of their parents, nor do you want to further polarize people hesitant to take vaccines to the extent that they refuse to come to clinics or hospitals completely. While an argument for bodily autonomy can be made, an even more compelling counter-argument can also be made about the necessity of herd immunity. For example, our bodily autonomy might threaten someone else's autonomy and access to a healthy environment.
You're set for a year.
Thank you so much.
The fact that we're not seeing them is not an indication that we don't need the vaccines. It's proof that they're working.
If it cuts down the number of days that you're sick, why wouldn't you take it? It's free, it's easy, it's quick because of access now in pharmacies, and it could save you a whole lot of aggravation.
What do you think we should be doing to keep our communities and our individuals healthy? Leave us a comment, like this video, and stay posted by hitting that subscribe button.